Hi everyone, my research was on the Closix adhesive non-invasive closure for the management of lacerations and abrasions. So for a quick review, an abrasion is a superficial injury resulting in a break in the continuity of the skin. Most are confined to the epidermis and therefore have minimal bleeding. There are three main types of abrasions, with one of them being linear. Sutures are the most common type of primary wound closure. More than 70% of childhood injuries are abrasions, making them the most common childhood injury. Lacerations are also a common cause of emergency department visits. Both small abrasions and lacerations typically close by primary intention. So for the device, it is a closure device that is non-invasive and adhesive, and it is made of polyurethane and polymetric films. It has an interlace design to assist in securing and approximating the wound edges. It can be used to close any clean, acute wound, including superficial lacerations, surgical incisions, and linear abrasions. I have listed the contraindications here. Benefits of using this device include reducing emergency department wait times, healthcare costs, number of needle sticks, patient anxiety, and the risk of infection. There are 11 different device sizes that can be chosen from based on the size and the shape of the wound. There is no need for a follow-up visit with this device because it will slough off on its own in 7 to 10 days. So for the efficacy of the treatment, I have listed here several different research articles for different wound types. And so for the first, there is insufficient evidence to determine whether adhesives or sutures were better for port site wound closure. However, adhesives were applied faster. Adhesive skin closure strips were favored to close fasciotomy wounds in pediatric patients where surgical procedures were non-advisable due to the risk for general anesthesia. Adhesive skin closure was compared to absorbable sutures for wounds following cardiac surgery. Adhesive closure was shown to have significantly less erythema at 7 and 21 days and less edema at 7 days. Saphenous vein harvesting during coronary artery bypass graft surgery can be closed by adhesives as well, and it was shown to have less edema, less erythema, and better cosmetic appearance at 7 and 21 days when compared to the sutures. Pain was also significantly less at day 7, and time to closure was faster for the adhesives. Adhesives were also favored for pediatric spine surgery because it was more time efficient. However, there was no difference in complication rates. So based on this evidence, I would not currently recommend the Closix device simply because of the limited amount of research. Most research seems to be affiliated with the 3M Steri strips.